Hey everybody, thanks for joining us. We're going to change it up a little bit this afternoon and do a facial procedure. What we're doing for this nice lady is restoring some facial volume using her own fat. What we've done already is harvested the fat from her abdomen manually, and we've separated it into these 10 cc syringes that have been centrifuged over there by our nurse Shannon, and now it's separated into fat, oil, and serum, and a little bit of the saline from the tumescent. So what we do is let that empty out, as you see here. And Louis, you can start wicking these. And then we'll insert a felt pledget to wick off some of the oil at the top. What we'll do next, she doesn't have a lot of oil, which is great. What we'll do next then is divide all this volume up into 1 cc syringes, and we'll start to restore this volume in a very organized way. We've got about 10 syringes drawn, and it looks like they have at least 5 cc's of fat. Some look like they have 8. So she's going to have about 70, 80 cc's of fat available for this, which is great for this kind of case. Okay, so now that we're wicking this off, and we're done with that, we'll take these pledgets out. They look pretty dry. Flip this around. Oops, sorry. And then we'll use our connector. Here it goes. And we'll start condensing these into full 10 cc syringes, so we'll know what our starting volume is. Louis, you want to look at this so they can get a close-up of what it looks like? There you go. So it's 10. Now we'll get the next one out. And good work. I get all the air out of these. And we want to be really gentle with our pressure as we transfer this, because high pressure can lyse the fat cells. Okay. Okay. Great. So far we've got about 30 cc's of pure fat, and this looks like will be over 40, which is great. It's a good amount. And the last 4 that have just come out of the centrifuge, we'll do the same thing with, sort of thing with, okay? I'm not even gonna wick these because you just don't need to. Okay, turn these over. Right. There you go. What are you doing there? Good. So you got 50 so far, right? Okay. This will be 60. And we have just under 70 cc's available. Now, if you think about it, if you're using a filler like Restylane or Juvederm to add volume, this would be the equivalent of 70 of those syringes, because those are, and that would be super expensive. Okay, we're done. There you go. So we'll come to this back table here, and we'll start getting ready. We have about 70, just under 70. We'll start planning on how to restore the volume. So what you'll see here, these circles are what I drew in the pre-op holding area, and these lines, those are all the flat spots and grooves that she has. That's where we want to bring this volume up and then start restoring the shape of her face, okay? She does not have a lot of fat, obviously. That's why we're doing this, so you can almost see the veins through her skin, almost like an anatomy book. So the first thing I'm going to do is use an 18 gauge needle to make a little cannula site so I can get my cannula through there. I start with a smaller cannula and I progressively go up to fatter and longer cannulas depending on which part of the face I'm at. What I like to do first is build up this malar area, and okay, so you can see this in here, and what I want to do is gently inject this fat, and you'll see me do this obviously 70 times, probably like 30 plus times on each side of her face, and we'll watch the effect that this is having as we inject it. It's got a little bump there from injecting the local. Nice. Okay, I'm going to switch to a slightly longer cannula, hopefully. Can I get the other one? This is round. Yes, better. Okay, so what I'm going to do now that I've started building up this way, I'm going to go deeper towards the corner of her mouth, I'm sure, and across the nasolabial fold, so I can pick that up a little bit. She has deep nasolabial folds, and that's that blue line going down into this marionette line there. What are we at, Shannon? Total? That's it? Are you serious? I feel like I've been working all day. I have, but just not on this patient. This is 4? Wow. Hope I make it to the end of this case. I might need a nap, yes. Okay, so. What are we at now? See, it's taking shape very nicely, slowly. 6. See, so I come across just under the eyelid, you know, that nasolacrimal groove there, and pick this up. So it's puffing up nicely. Pretty soon I'm going to turn around and come up the other way, and a lot of, we want, like she's feeling that a little, Tom? We want these overlapping, very thin strands of fat, because you want to make sure that the blood supply has the best chance of getting to this. I'm going to do the same thing that I did here, make a small cannula site just outside the corner of her mouth, okay? And once again, start with my smaller cannula. I'm going to start by going just below the nasolabial fold, just deep to it. All right? Look at that. That's nasolabial. Now I'll come on either side of it. Bring that up a little bit. Now what I want to do is come across the white line of her upper lip to start bringing out these small, some people refer to as smoker's lines, but she's not a smoker, so I guess it's from aging. Okay. Lip lines, is that what you call it? Crepey lip lines? Shannon's going to write her own book with her own anatomical terms. Okay, now I'm coming back up into the malar area again. I'm coming deeper now, protecting her eye. You see how that's coming up nice? See that, Lisa? You can talk. This is a participator sport. So now I'll use my longer cannula to come up deeper and higher. I have my finger right along the lower orbital rim, and now I can start to sort of come out here. Now you gotta have to be careful patients who have very, very thin skin, so to speak. You want to be deep, otherwise you'll start to see what looks like veins, but it's really ribbons of this fat. So ideally you want to go deeper and use a fine cannula. I'm going to move her tube a little bit without upsetting Dr. Barson by extubating her. We've never done that. 10 years that we've been together. We've been together longer than the Beatles, Tom. You know, I don't think people will be as upset if we break up. Okay, so, okay, going into the same thing, white line on the lower lip. Okay, now I'm going into the canine fossa there, right? And then I'm going to switch to my longer cannula and come across and build up the labiomental fold. When you lose fat in this area, it kind of causes this, can you give me a lap, please? This impression of pursing of the lips. And it's all because that structural support is gone. And that's why fat is so important. You know, the sad thing is you only lose fat in places that you don't want to lose it. Huh? Yeah, well, you know, I think it's God's way of taking you off the market. Less competition for younger people. What do you think, Louis? What? Okay, so we did labiomental fold, lower lip, and now we're going to come back here a little bit, but I'm going to be careful. Okay. Okay, quiet. I want arguments about head position. We'll just go with it. What does that smell? Is that the glue? What? All right. Okay, look at how smooth that looks. Nice, right? Okay. And you're not just saying that because it's me, right? What's our total volume? So what we're gonna do, huh? Okay, wow. We're doing really good. Now I'm gonna go deep. Try not to mess with this vein. We're gonna go into this temporal hollow here that some people refer to as Cougar's sign. You never did? Well, you don't go to enough plastic surgery conferences, and then again, neither do I, but when I hear a pearl like that, I love sharing it. Yep. It's always, you know, interesting when you use expressions that make patients feel very insecure about themselves. I try not to when I tell them, look, I didn't make this up, you know, but be very careful because we don't want lumpiness, but you can still see that vein, right? See that? So we're going to be careful. Can I have, I'm going to come up over the upper part of the orbital ring here. Once again, avoiding that vein. Our skin looks so much nicer, doesn't it?
Yeah.
What I definitely, you know, there's always debate about how long this fat lasts and what the value really is of it. I'll tell you the one thing that I never used to expect and I was always impressed by was the effect that the fat has on the appearance of the skin. It always looks so much healthier. And I think a lot of it has to do with growth factors in the fat. Does that make sense, Lisa? It's almost like PRP sort of thing. Yep. Yeah, but I'm saying just texture-wise, not even volume. Shinier. Good. Coming out. Come on, Louis, give me the longer one. I want to see if I can reach this corner of the because if I can, it saves us a lot of problems. Oh, look at that. Almost. Oh, good. Gentle. What are we at totally on this side? See how you can see that? We want to fix it. How much? So it's 17 on this side. So look at the difference. Isn't it? It's really cool, I think. So let's go for 20 on this side before we go to the other side, and we'll come back and make small corrections as we need them, right? I want to get down into this line here. She's like a great candidate. First of all, she has enough fat, you know, and everyone thinks they have enough fat. Some people are so thin. You know, we've got some folks in this practice that take pride in exceptionally low body fat, and it makes life very difficult. Where are we at now, Shannon? This is 20 in my hand. Now I'm going to an even smaller cannula and coming right underneath these small wrinkles. Oh, she's getting a little bit of a ooziness here. You want to keep this clean. Come this way. Try to bring it up. It's would have been very nice for Tammy to see. What? Okay. Something a little deeper. Bring that out. You also take the risk of making it look a little too heavy, especially in the lower face. You know, we still have that friend of ours that we saw that had a fat transfer elsewhere, and it kind of accentuated her jowls in an unflattering way. You know what I'm talking about, right? So that's not the look we're going for here. I want one more in the labiomental fold to just bring out her chin a little bit and to open up the space down here. Okay. Tom, can we, at the end of the case, can we have a dose of Clinda? Good. Good. Ah, I mean, it's a different person, right? Okay, so how many do we have? 21 on this side? $22? Okay. Let's move this back. So we're going to start the process all over again on the left side. Once again, make our small cannula site. Okay, so I'm going to go deeper and closer to the midline here. Bring this out, go deep. Where are we at now, Shannon? Huh? That's where I was at the other side, at about exactly the same time. Okay, good. So Lisa, what do you think of this? You think it has a nice effect, right? You know, the other thing is, we always tell patients, it's kind of hard to predict how much of this volume will remain, which is why we like to overcorrect a little bit. You know, in a perfect world, you'd want at least 70 or 80% of this to stick. But we always tell them there's a possibility they might need a small revision if they lose more volume than they like, or if there's an asymmetry that bothers them, which we will do that just for supplies. And the second time, it seems that the previous, like I said, the previous procedure, previous fat, actually enhances the take on the next graft, you know, because the blood supply seems to be augmented a little bit. Yeah, a little bit. So all that is really, really interesting. You know, the guy that really pioneered this and made it mainstream is a guy named Sidney Coleman in New York. And when he first started publishing papers or speaking on it, everyone was very skeptical about it, which is typical for any business, I guess, right? You get your critics and detractors. And, you know, fast forward 10 or 15 years, everybody's doing it. I mean, I don't know if there are many guys that do full facelifts that don't in some way include fat, you know, because, and more, how many cc's do we have in the malar area on this side? On the other side. Okay, so I already have 9 here? Wow. Let me come to the bottom, Lewis. You're gonna hold a little pressure on this here. I think I got close to a vein, and I'm gonna, no, come on this side, and I'm going to inject the malar inferior to superior. And then when I'm done with that, and I'm happy that I've got close to a good match, right and left side, then I'll do the lower part of the face. So you said we did 22 cc's on this side, correct? Huh? Okay, I think I could actually come across this way. I should have injected more local. Do this is just a little bit under the nasolabial here. How many do I have on the nasolabial on the other side? 2. Well, you could count that as 1. And this will be 2. Beautiful. Let's go upward to our spot here. Lewis, help me. Pull down. Okay, I'm going to keep my finger here for safety. How many is that? It's 10 in the malar. I don't know if I'm counting this as malar, but you can. The other side was 11. Yeah, I want to hit this middle spot here with one more. Just load them up. And then I want to come laterally a little bit because this looks fuller here. Okay, I'm going to come down from the top again. Switch sides to get this area here so it matches a little bit better. Okay, I figured I was missing something here. Okay, as long as we're even, I'm good. There's one. That's good. She's got this very superficial vein here. Maybe that's what gave us a little bit of bleeding. It's really good. Yep, that's much better. Okay, let's go to the lower face here, move her endotracheal tube without causing her a problem. Okay, we're going to go on upper lip. I'm going to come across to get to the midline here. I'm going to get a longer cannula. Thread it through. Good. Okay, there you go. Going to have a fat lip temporarily. They're often really surprised by the amount of swelling that they get, you know? Okay, same thing, lower lip along the white line. Yeah. It's our little bleeder from the lip. Let's hold pressure here for a second. We still have labial mental folds, right? Okay. Just want to try to get a little control of this bruising here, bleeding so she doesn't get bruising. Okay, marrying that line. Switch out. Can you give me the slightly longer one? I want to come across labial mental fold. Okay. See how far I can get. Good. How much did I put labial mental fold to? On the other side? Huh? Just one more lift. What is my total on this side now? Huh? Both sides, 22, 22? Oh shoot, to go up here. A what? That's okay, because that's what I needed to do to make it even. But what I want to do is come up here now. No, I'm used to getting that much bleeding with this. We'll switch sides. Gotta hold pressure. So I can come. Wow, that's some change, huh? Come down. Come down. Good. So let's focus on here. How much do I have in 2? Brow. Just hold pressure. So did you get any word on when they're coming back next door?
Yes, they should be there now.
Now?
They should be when I get there.
It's funny how you get like this other guy here. He just says, yeah, I'll be there and it'll be done and it's done. You know? Which is nice. Okay. You said there were 2 on the other side? What? But you see how it's flat now. It's nice, right? See, so, I mean, if you could use this technique with something like Sculptra or one of these other semi-permanent, do you see the scar?
Yeah.
Mm-hmm. If you could use Sculptra, this is why this is a good opportunity to really understand, you know, this. Because you don't want to learn on your patient. Get it? Deanna, you're very quiet in there. How are we doing? Yeah? Good. You know, a lot of good hashtags here for, you know, YouTube. See, so this, see how this, she has this like fullness from this muscle here. And we'd like to be in here. So let me see if I could do this without causing too much bleeding. Getting better. Keep holding pressure down, Lewis, till the end of the case. Feel like, what was that little boy that put his finger in the dike? What was that children's story? You know what I'm talking about, right? You've never heard that story. The dike was about to like give way and it had like a little hole in it, so he wouldn't put his finger in there. And he had to stay there forever. You never heard that story? No. Lisa, you have children. Tell me you don't know that story. Wow, I'm gonna have to buy you guys like some children's books. Was it like a Danish kid with clogs? See, I remember that. I remember the fashion part of it. He's wearing overalls and clogs. Okay, good. Hold on. You know, she tends to, looks good though. So what's our total volume, Shannon? Huh? Hold on, I told you. What'd you say? On this side? We're probably going to want to put a little bit more on the brow on the other side, because this approach is bringing this out a lot better. Lewis, hold pressure here now. You're the pressure guy. Switch sides again.
You're the little danger.
Put your finger in the dike. Nice. Okay. Man, brutal. All right, so, oof. See how good I am? I get right to the spot that bleeds. I don't think you could do that if you tried, but if you're me, it's 100%. 100%. Wow, that's really good, right, Lewis? Mm-hmm. That gave us a really nice correction. Wow. Look at that. Okay, so let's hold pressure here. That really gave us a nice correction on his brow, Lisa, by the way. I know you're busy gossiping with Shannon. We're done. Okay. So, how many cc's total?
26.
So we've got about 50 cc's of fat injected into this nice lady's face. It's restored her volume very nicely. I think I want to be out here a little bit more. What do you think, Lewis, right here? Yep. Yep. So I'm just going to finish up with these last couple of cc's of fat, and then she'll go out to recovery, or she'll stay for a short time, and then we'll see her tomorrow for a wound check. Make sure she's doing okay and that her swelling isn't crazy. You know, that expression in the medical school, crazy swelling. You know. Yeah, I'll be signing off right now. That was my goodbye. Anyway, thank you for watching. Please subscribe. We love your comments. Tell your friends about this. And if there's any type of surgery you'd like to see, let us know. We'll look for it and make it happen. Have a great day.
We're moving through the night like we're from a different star, flying over streets and our broken hearts.